Let's begin the vagus nerve here. The vagus nerve. Vagus nerve is the longest cranial nerve. If you think about as such, the vagus nerve is the longest cranial nerve. Obviously, the meaning of the word vagus means wandering. So this nerve is going beyond the head and neck part into the thorax and into the abdomen also. So बहुत लंबा course, and that's how it is. It is a wandering nerve. It's a very long nerve. It is not advisable. It is not advisable to try to remember everything about the vagus nerve in the beginning only or here itself, because as I said, vagus nerve we have a different part. We talked about a little about the vagus nerve, how it contributes to the cardiac plexus, superior cervical cardiac branch, inferior cervical cardiac branch. Similarly, we will again talk about the vagus nerve when it goes into the abdomen and contributes to the different plexus there. So we will be focusing onto the vagus nerve with respect to head and neck here. With respect to head and neck, vagus nerve, just like glossopharyngeal nerve, will be coming out of the medulla oblongata. So once again, this here is the pons and there is the medulla oblongata, and vagus nerve will come out of the medulla oblongata again. Vagus nerve will also go out through which foramen? Same, that is the jugular foramen. So there we have it. This is the jugular foramen here. Let me write in short, that is jugular foramen. Vagus nerve will also have the two ganglion, the superior ganglion and the inferior ganglion. So here is the vagus nerve coming out. The superior ganglion of the vagus nerve is present at the level of the jugular foramen, exactly at the level of jugular foramen, and inferior ganglion is present little lower. So we got two ganglion here, the superior and the inferior ganglion. And if I just tell you a little about the superior and the inferior ganglion separately here, guys, we have a superior and the inferior ganglion of vagus. Superior ganglion, inferior ganglion of the vagus nerve. I told you these ganglions, whether it is glossopharyngeal nerve or vagus nerve, these are sensory ganglion. This superior ganglion of the vagus nerve, is basically carrying the cell bodies for those nerves which are GSA, general somatic afferent. Superior ganglion is for the GSA nerve, the nerve which will be carrying the general somatic sensation, like any like from the ear, let's say, if I say. Inferior ganglion, on the other hand, inferior ganglion is carrying the sensation from the viscera, that is GVA, SVA. So that will be carrying the sensation from the viscera. So as I said, general somatic afferent, if you remember, the huge trigeminal nuclei was there. And general somatic sensation means the general sensation from the body wall. Like if there is any branch of vagus nerve which is supplying the dura mater, or if there is a branch of vagus nerve which is supplying the skin, anywhere, if it is supplying the skin, the cell body of that nerve is present in the superior cervical ganglion. The cell body of that nerve is in the superior cervical ganglion, and that's how it is. So what you will see, from the superior cervical ganglion, a branch of the vagus nerve will be seen going back into the cranial cavity, and that is called as the meningeal branch. And this meningeal branch is obviously supplying the dura mater of which fossa? Dura of the posterior cranial fossa. So there is a meningeal branch which will go from the superior ganglion above, and that is going to supply the dura mater of the posterior cranial fossa. There is another branch which will come from the superior ganglion, and this branch which comes from the superior ganglion, how it exactly comes out, again it is coming out between the external auditory canal and mastoid process. There is a fissure called as the tympanomastoid fissure. Not important, guys, not important as of now. Again, when we will reach that part, I'll tell you about this. So this is a branch of vagus nerve which is called as the auricular branch of vagus nerve. So there is an auricular branch of vagus nerve which is basically going to supply the skin of the external auditory canal and the adjoining area. So let us say if this here is the ear, and that is the external auditory canal. So it is going to supply the skin of the external auditory canal and the adjoining area. It is going to supply the skin of external auditory canal or external auditory meatus and adjoining area. This is what the branches which are coming from the superior ganglion will do. The two branches coming from the superior ganglion We have a meningeal branch, which is supplying the it goes back into the cranial cavity. So obviously it will supply the dura mater of posterior cranial fossa. And the auricular branch here, on the other hand, will supply the skin of the auricle. It will supply some part of the skin of the auricle. In fact, it's a very important clinical anatomy here about the vagus nerve that I will be telling you. Auricular branch of the vagus nerve supplies the skin around the ear. Whenever you go to any ENT doctor, I don't know if you've ever been to any ENT doctor, and if you have got done anything in your ear, it is always done in the sitting position. The ENT specialist will make you sit or will make you lie down, and then he will try to do any whatever procedure they have to do in the ear. The reason is because vagus nerve branch is supplying the external auditory canal, and if you try to touch that area with the syringe, or you just try to manipulate that area which is supplied by the vagus nerve, a person can get a syncope also. Usko chakkar bhi aa sakte hain. So that area here, it's very important because it is supplied by the vagus nerve. It is supplied by the vagus nerve. Vagus nerve is actually, it is responsible for all these feelings. We will be able to understand this actually in the neuroanatomy, but I'm just telling you that stimulating or kind of irritating the area which is supplied by the vagus nerve can lead to a syncope also, can lead to vomiting also. Aapko vomit ho sakti because vagus nerve is responsible for the gag and vomiting. So that can lead to the gag and vomiting also. And one interesting fact I'll tell you, that this auricular branch of vagus nerve is also called as an Edelman's nerve. I'll tell you what is Edelman's nerve. This auricular branch, let me just point out here. This auricular branch, iska naam hota hai Edelman. It is also called as the Edelman's nerve, or also called as the Arnold's nerve. Edelman or Arnold's nerve. You know what is this Edelman or Arnold's nerve? Edelman to basically एक population के नाम पे इनको दिया है. Edelman population, they used to have these competition of eating. कौन ज़्यादा खाएगा? Such weird competition they have, like. And what they used to do then, let's say if the 4 or 5 men are competing with each other for eating more, they used to keep some ice or some spirit with them. And what they do, that they keep eating and they keep on pouring the ice or spirit on the ear, behind the ear, on this region, which is supplied by the vagus nerve. They don't know the anatomy or the mechanism behind it, but they understood this thing, that if you stimulate this area, this region here, then obviously vagus nerve will get stimulated, and vagus nerve increase the gastric mobility also. Gastric mobility increase hoga, so obviously you will feel more hungry. Your appetite will increase. And if your appetite will increase, you'll be able to eat more. So that competition, that Edelman population, which we used to have these stupid competitions of eating more, then they used to like keep some spirit or some cold water or icy water with them, and they just keep on pouring that water on the ear, keep eating, keep on pouring that water and keep eating. That will keep on stimulating the vagus nerve. Vagus nerve increase the gastric mobility, increase the appetite. So that is Edelman's nerve or Arnold's nerve. Auricular branch, Edelman's nerve, Arnold's nerve, sab ek hi matlab hai. Well, this is about the superior ganglion, guys. From the inferior ganglion, now main vagus nerve, obviously the main trunk of vagus nerve will continue downward. We said it is running downward. We saw it is running in the into the mediastinum also. If you remember, the vagus nerve was running along with the esophagus and passing from the esophageal opening of the diaphragm, and then it will go into the abdomen and become gastric nerve. So if I say this vagus nerve, it will continue. That's a main trunk of vagus nerve. This will continue downward, and this will go into the thorax and into the abdomen. But we need to focus on the part of the vagus nerve which is in the head and neck part. From the inferior cervical ganglion, there is a branch of vagus nerve which comes out, which is called as the pharyngeal branch. Once again, guys, pharyngeal branch is the one which will contribute to what plexus? To the pharyngeal plexus. It will contribute to a plexus called as a pharyngeal plexus. It's a plexus which is present around the middle constrictor muscle. We already saw one contribution to the pharyngeal plexus is coming from the glossopharyngeal nerve. See what exactly pharyngeal plexus is doing, what exact muscles are supplied from them or not. This is a topic to be discussed in the pharynx only. So let's not get into the detail of the pharyngeal plexus. So remember that there is a pharyngeal branch coming from the level of inferior cervical ganglion, and that contributes to pharyngeal plexus. Something common in this nerve and the glossopharyngeal nerve, that this also is going to supply the carotid body and carotid sinus. Vagus nerve and glossopharyngeal nerve, they both supply the carotid body and carotid sinus. So I'm writing CB and CS, carotid body and carotid sinus. This is simply called as the carotid nerve or sinus nerve. Carotid nerve or sinus nerve, whatever you call it. Don't call it nerve of Herring. Nerve of Herring was name given to the branch of glossopharyngeal. This is simply called as a carotid branch or sinus nerve. So you can see there are few things which are common, here. Both glossopharyngeal nerve and vagus nerve, they're starting from the medulla oblongata. Both glossopharyngeal nerve and vagus nerve, they come out of the jugular foramen. Both these nerves, they supply the carotid body and carotid sinus. So there are few things which are common, which is done by the glossopharyngeal nerve also, and that is done by the vagus nerve also. Okay, what else, guys? Now comes to the important part here. Vagus nerve, and for that, I again have to take you back to the same picture. This one, let me just make a copy of this image. And this time, it's not about the glossopharyngeal nerve, it is about the vagus nerve. Guys, look at this. This is about the vagus nerve. Let me explain this to you here, and then it will be very easy for you to understand in the schematic diagram. Now, let us say that is a vagus nerve which is going down. Let's say that's the main vagus nerve we're talking about. From the level of the inferior ganglion, whatever is discussed is discussed. Now I'm going to the other part here. There is a branch of vagus nerve which will run downward toward all these muscles here. This branch of the vagus nerve is called as superior laryngeal nerve. Now look at the name first. I'll write everything in the schematic diagram. Just understand it here. That is superior laryngeal nerve. Superior laryngeal nerve is going to divide into two branches. One branch of superior laryngeal nerve will basically pierce this thyrohyoid membrane. What was the membrane, guys? That was a thyrohyoid membrane. It is between the thyroid and the hyoid. And so it is piercing or going through the thyrohyoid membrane and enter inside. And one branch of superior laryngeal nerve will come down and supply the only muscle of larynx which is present outside. This one. Not inferior constrictor. I'm not talking about inferior constrictor. You can see a small muscle which is present in front here. This is the muscle. This is one muscle of larynx which is outside. Otherwise, muscles of larynx are inside the larynx. And what is this muscle of larynx called as? This muscle of larynx is called as it is between the cricoid cartilage and thyroid cartilage. So this muscle is called as cricothyroid. This muscle is called as a cricothyroid. So cricothyroid is the only muscle of larynx which is supplied by this nerve. So what you will name them? This nerve, because it is coming from above, so we call it superior laryngeal nerve. Now it divided into two. One nerve which goes inside is called as internal laryngeal nerve, and the one which is outside is called as external laryngeal nerve. So superior laryngeal nerve will come down and divide into the internal laryngeal and external laryngeal. जिसका नाम external laryngeal है, the only function of external laryngeal nerve is to supply one muscle, and that is cricothyroid, whereas the internal laryngeal nerve is going inside. And why is it going inside? So that it can supply the mucosa of the larynx above the vocal cord. We can divide the entire larynx in two parts, above the vocal cord and below the vocal cord. That is a landmark in the larynx. We will discuss that later. So the interior of the larynx, the inner mucosa of the larynx above the vocal cord is supplied by this internal laryngeal nerve. That's why it is going inside. It supplies the mucosa of the larynx above vocal cord. So overall, what superior laryngeal nerve is doing, the superior laryngeal nerve is overall, it is supplying one muscle. Which muscle? Cricothyroid by the branch called as external laryngeal nerve. And it is supplying the mucosa of the larynx by the branch called as the internal laryngeal nerve above the vocal cord. अब question ये है कि क्या बच गया? What is left? What is left in the larynx to be supplied? Well, all other muscles of the larynx except cricothyroid and the mucosa of the larynx below the vocal cord is still to be supplied. We still have to supply the other muscles of the larynx, and we still have to supply the mucosa of the larynx below the vocal cord. Well, that is done by the branch of the vagus nerve which is given off in the root of neck mein, and that branch actually comes back like this, running between the trachea and esophagus in the tracheo-esophageal groove. And that nerve is called as the recurrent laryngeal nerve. You heard about this nerve in thorax also, guys. Recurrent laryngeal nerve. There's a different story for both the recurrent laryngeal nerve, but that's called as a recurrent laryngeal nerve. So recurrent laryngeal nerve, obviously what is there for the recurrent laryngeal nerve to supply? Recurrent laryngeal nerve will supply the all muscles of larynx except which one? Except the cricothyroid. And this will also supply the mucosa of the larynx below the vocal cord. That is why it is like running like this, and it will be running in between. It is running between the trachea and esophagus and will go above. It will running between trachea and esophagus and go above. And that's why after this point, guys, after this point, this can also be called as inferior laryngeal nerve. So this makes sense now. Superior laryngeal nerve ऊपर से आ रहा है. When the recurrent laryngeal nerve actually comes in the upper part, some author call it inferior laryngeal nerve also. That's the whole nerve is called as recurrent laryngeal nerve, but this portion of the recurrent laryngeal nerve can also be called as the inferior laryngeal nerve because it is coming from below and supplying the mucosa of larynx and the muscles of the larynx except cricothyroid. In the neck, I hope you also remember there are two branches coming from the vagus nerve which were contributing to the cardiac plexus, guys. That was a superior cervical cardiac branch and it was an inferior cervical cardiac branch of the vagus. Superior cervical cardiac branch, inferior cervical cardiac branch of vagus are also given off, but they are going and contributing to the cardiac plexus, which we are not going to discuss. I just have to tell you that these branches are also given off in the neck. They're also given off in the neck. Let's come back to the diagram and put it in a diagrammatic way. So we said, we've already discussed this part of the vagus nerve. To understand the rest of the vagus nerve, let's do one thing. Let's draw those things in between. What we have here is, we have hyoid bone. Let us say this is a thyroid cartilage. I'm just drawing it very schematically. That's a thyroid cartilage and there is a cricoid cartilage. So this is hyoid. This is thyroid cartilage and this is the cricoid cartilage, which again will be discussed in detail in the larynx only. Between the hyoid bone and thyroid cartilage, the membrane that you saw, that was a thyrohyoid membrane. That membrane is a thyrohyoid membrane. Right, that's a thyrohyoid membrane. And we said there is one muscle of larynx which is present outside. All the muscles of larynx are inside, which we will be discussing all the muscles of larynx separately in the larynx part. One muscle of larynx which is present outside. What muscle is that? That is the cricothyroid muscle. It is between the cricoid and thyroid, so we call it cricothyroid muscle. The only muscle of larynx which is present outside. So we got the plot. We have the plot with us. We have a hyoid bone. We have a thyroid cartilage. There is a thyrohyoid membrane. We have a cricoid cartilage. And there is this muscle which is stretching between them, which is called as a cricothyroid muscle. Okay. So from the this inferior ganglion of this vagus nerve, you will see a branch, we said, of the vagus which will come down. That is a superior laryngeal nerve. And this superior laryngeal nerve is going to divide into the external laryngeal nerve which supplies cricothyroid. And the internal laryngeal nerve, what will it do? Internal laryngeal nerve will pierce the thyrohyoid membrane to go inside. So the nerve here is the superior laryngeal nerve. From now onwards, let's call it SLN, superior laryngeal nerve, which is dividing into two branches. I'm writing it short only. That is external laryngeal nerve. Do write it separately somewhere. And this one is the internal laryngeal nerve. The two branches, external laryngeal and internal laryngeal. External and internal laryngeal. External laryngeal nerve, as you can see, it is supplying the cricothyroid muscle. And internal laryngeal nerve, what internal laryngeal nerve is doing, if I may write it separately here. Internal laryngeal nerve, we said it is going to supply the mucosa of larynx. Mucosa of larynx, but where? Above vocal cord. Above vocal cord. Whereas external laryngeal nerve is just, it's a motor nerve which is to supply the cricothyroid muscle. It supplies the cricothyroid muscle. So that's the function of the two branches of the superior laryngeal, the internal and the external laryngeal. Internal laryngeal nerve is sensory, external laryngeal nerve is motor. One supplies cricothyroid muscle and one is supplying the mucosa. Just take the sensation from the mucosa. In the neck, we said the vagus nerve is also giving off the two branches in the neck, one in the upper part of neck, one in the lower part of neck. There is a superior cervical cardiac branch and there is an inferior cervical cardiac branch. Now, I'm not going to discuss these. We already talked about them in the cardiac plexus, guys. Inferior cervical cardiac branch of left vagus was contributing to the superficial cardiac plexus, and then rest all the superior cardiac branch and recurrent branch and all that, they are contributing to deep cardiac plexus. So superior cervical, because they are given off in the neck, so we call it superior cervical cardiac branch, and we have an inferior cervical cardiac branch. And finally, we got a nerve which is called as a recurrent laryngeal nerve. The nerve will go down and then comes back. This nerve is called as a recurrent laryngeal nerve. That is a recurrent laryngeal nerve. This recurrent laryngeal nerve is passing below certain artery. And this artery, it is different from on both the side. Like this artery is either it is arch of aorta. Arch of aorta on what side? On the left side. And if it is right side, then this artery will be the right subclavian artery. On the right side, it is a subclavian artery, right subclavian artery. Remember, guys, fourth arch, again, embryology. Fourth arch artery on the left side is forming the arch of aorta. So recurrent laryngeal nerve is below the fourth arch artery. So what is fourth arch artery? Arch of aorta here. On the right side, fourth arch artery was forming the right subclavian artery. So recurrent laryngeal nerve on this side is below the subclavian artery. And that is why the left recurrent laryngeal nerve is very long and right recurrent laryngeal nerve is short, because it just have to go below the subclavian artery and then goes back. इसको arch of aorta के नीचे से वापस जाना है. So left recurrent laryngeal nerve is longer. But whatever it is, whether it is right recurrent laryngeal nerve or left recurrent laryngeal nerve, once it comes back, the function of the recurrent laryngeal nerve is to supply what? It is going to supply the, first of all, it is going to supply the mucosa of larynx. Mucosa of the larynx where? Below vocal cord. Below vocal cord. And secondly, it is also going to supply all muscles of larynx. All muscles of larynx. Now, as of now, you don't have to remember those names. We will be discussing it in the larynx only. All muscles of larynx except cricothyroid. All muscles of larynx except cricothyroid. That's what the vagus nerve is doing. And uske baad bhi, obviously, vagus nerve will still continue after that and will go into the thorax and abdomen. We will take care of that vagus nerve in that respective part of the abdomen. So this is the relevant discussion on the vagus nerve, guys, that is needed in the head and neck. If I have a quick recap on this, we said vagus nerve, when it comes out of the jugular foramen, which is having two sensory ganglion are there. The superior one, the sensory ganglion, it is only carrying the somatic sensation, general somatic afferent wale fiber. Inferior is for the visceral. All the visceral sensation coming from the pharyngeal nerve, coming from wherever, the vagus nerve, whatever it is supplying, like sensation from the mucosa. Sensation from the mucosa of above the vocal cord, below the vocal cord will be coming from all these nerves from below here. So, unki jo cell body hai, that is present here. So, the inferior ganglion is basically the visceral ganglion. It is GVA and SVA type of sensation will come here. And superior ganglion is GSA. It is a general somatic afferent. Superior ganglion, say the branches which will come out, one is a meningeal branch to supply the dura mater of posterior cranial fossa. And it also gives off an auricular branch which supplies the skin of the ear or auricle and skin around the auricle or inside the auricle. This nerve is called as the Elderman's nerve or Arnold's nerve. From the inferior ganglion, something just like a copy of the glossopharyngeal nerve, it supplies the bifurcation of common carotid artery. It gives off a branch to the pharyngeal plexus. What is pharyngeal plexus? We will talk about that. No worries. It gives off a superior, that's important. जो आपको यहाँ पे main चीज याद रखनी है, that superior laryngeal and recurrent laryngeal. Superior laryngeal nerve comes down close to the larynx. It divides into two branches. One is internal laryngeal, which pierces the thyroid membrane, goes inside and supplies the mucosa above the vocal cord. External laryngeal nerve is going to supply the muscle, that is cricothyroid muscle. It is supplying the cricothyroid muscle. Recurrent laryngeal nerve, it is basically coming below certain artery. On the right side, it will come below the subclavian artery, right subclavian, and on the left side, it will come below the ligamentum arteriosum, or you can say below the arch of aorta. It will come back and supply all the muscles of larynx except cricothyroid and mucosa below the vocal cord. Mucosa below the vocal cord. So this is about the longest cranial nerve only in the head and neck part, that is vagus nerve. Okay. I hope you understood this part, right? Chalo. Like I'll after that, once we are finished with this now, I'll show you one picture, a very complicated picture though. But again, we'll try to identify some nerves on this. Everything cannot be identified as of now because we still have to, we have long way to go in head and neck. But still we will be able to. Picture mein rakhi hui, look at this. This picture looks like a mess. This looks like there's so many nerves are there in it. But we will try. We will try few nerves. We'll try to identify few nerves in this, whatever we can. Let's move on to the next nerve, guys. The next nerve is the accessory nerve, the 11th nerve. 11th nerve is called as accessory nerve. It is having two parts. One part of this accessory is called as the cranial accessory. And one part of this nerve is called as a spinal accessory. The reason for calling them cranial and spinal accessory is because the nucleus of cranial accessory is nucleus ambiguous. If you remember nucleus ambiguous was present in the medulla oblongata. It was a common nucleus for 9th, 10th and 11th nerve. That was nucleus ambiguous, that is cranial accessory. And the reason the second part of this nerve is called as spinal accessory, because the origin of this nerve is actually from the spinal cord. The nucleus for this nerve is present in the spinal cord. It will be coming from the C1 to C5 level of the cervical spinal cord. The origin of this nerve will be from the C1 to C5 level of the cervical spinal cord. So cranial accessory and spinal accessory. देखो guys, we are discussing rest of the cranial nerve for your knowledge so that it will enhance your grip in the head and neck. But from the exam point of view, mandibular nerve, facial nerve and glossopharyngeal nerve are important. The nerves on which the questions are asked. I mean, write a short note or long note on whether it is trigeminal nerve, whole trigeminal nerve can be asked. Especially mandibular nerve is very important, which is asked. Facial nerve, undoubtedly very, very important. Facial nerve, the most important. And even glossopharyngeal nerve also can be asked. Vagus nerve, cranial accessory nerve, they're usually not asked. They're usually, I mean, पूछने को कुछ भी पूछ सकते हैं, but usually they are not the questions in the written exam. It's usually from the facial nerve, glossopharyngeal nerve, or from the trigeminal nerve. But obviously we have to understand these. If you don't understand these nerves, then you will not be able to have a good grip on the head and neck. Okay, now let us see how exactly this nerve will do this function, guys. Let us say this is a medulla oblongata, and here we have a spinal cord. That's a part of the brainstem, that is a medulla oblongata. The lower part of that is medulla oblongata, and that is a spinal cord. Here is the medulla oblongata. And that is spinal cord. Let me differentiate the two. Let's say medulla oblongata is still here. That's medulla oblongata. And rest everything here, this is the spinal cord. So we have a two origin. We have basically two nerves, two separate nerves are there. Later on, they will fuse and look like a single nerve. But we have two separate nerves. One is spinal accessory and one is cranial accessory. First and the foremost, the medulla oblongata is leaving the cranial cavity through this huge foramen called as the foramen magnum. There's a big foramen here, that is foramen magnum. And there's another foramen here, that is jugular foramen, that we've been talking about. This is called as the foramen magnum. And this here is the jugular foramen. Foramen magnum and jugular foramen. Okay. Now, cranial accessory nerve, whatever function is done by the cranial accessory nerve, it is not done by the cranial accessory itself. It is done by the vagus nerve. Vagus nerve is coming out of jugular foramen, and cranial accessory will join it. And then it will use the vagus nerve to reach its destination. What I'm trying to say here is that if I just put the vagus nerve first, let me just put the vagus nerve. We have vagus nerve, there is a superior ganglion of vagus nerve. There is an inferior ganglion of vagus nerve, and that is rest of the vagus. Just only draw this part of the vagus, nothing much. That's vagus nerve here. We saw the branch of the vagus nerve coming from here, that is superior laryngeal nerve. That is a superior laryngeal nerve, that is a branch of the vagus nerve, right? Okay, let me just leave it from here. There is vagus nerve, and that's a branch of vagus nerve, superior laryngeal nerve. What cranial accessory nerve will do? Now, as we said, the origin of the cranial accessory nerve is from this nucleus in the medulla oblongata, that is the nucleus ambiguous. Let us say in the medulla oblongata, that here is a nucleus ambiguous. Now, this, starting from the nucleus ambiguous, the cranial accessory nerve will come out individually. It will leave the jugular foramen individually and join the vagus nerve just below the superior ganglion. This here is what nerve? That is cranial. That is having a cranial origin. So that is cranial accessory. Cranial accessory nerve comes out of the jugular foramen separately, but it joins with the vagus just below the inferior ganglion. And then you will see the fiber of this nerve are carried by the superior laryngeal nerve. And then these fibers, they will separate and will contribute to the plexus we have been talking about. What plexus is that? That is a pharyngeal plexus. It is contributing to the plexus called as a pharyngeal plexus. So first thing first, cranial accessory nerve, it left the medulla oblongata coming out of the nucleus ambiguous separately. It leaves the jugular foramen separately. It joins the vagus nerve just below the inferior ganglion. That means after that, you will not be able to see the cranial accessory nerve. When you see the side of the neck or dissection of the neck, you are not able to see the cranial accessory nerve after this point, because it has joined with what nerve? With the vagus nerve only. Which branch of vagus nerve? Superior laryngeal nerve. And then it separates from the superior laryngeal nerve to contribute to pharyngeal plexus. Now, what exactly cranial accessory nerve is doing by going into the pharyngeal plexus? The function of cranial accessory nerve is basically to supply the muscles of palate, and it also supply the muscles of pharynx. Now you don't have to remember all the names. It is going to supply the muscles of palate and muscles of pharynx, except what? Now, exceptions we have already done. Muscles of palate, except which muscle? There is one muscle of palate we discussed yesterday called as a tensor veli palatini, and it was supplied by the trunk of mandibular nerve. So all the muscles of palate, whatever muscles we have in the palate, we have a muscle like levator veli palatini, tensor veli palatini, palatoglossus, palatopharyngeus. Abhi zarurat nahi. We don't have to remember those names for now. But whatever muscles we have in the palate, they are all supplied by the cranial accessory nerve using this pharyngeal plexus. What exactly this plexus is, that also we will discuss later. Except tensor veli palatini. Tensor veli palatini, we already know it is supplied by what nerve? It is supplied by the mandibular nerve. It was the mandibular nerve supplying it. And muscles of the pharynx, except which one? Guys, except which one? Except one muscle we discussed today, and that was stylopharyngeus. Stylopharyngeus. As we said, stylopharyngeus is the only muscle supplied by what nerve? Glossopharyngeal nerve. So these two exceptions you have to keep in head. Muscles of the palate except tensor veli palatini, and muscles of the pharynx except stylopharyngeus. They are rest, everything else, all other muscles of palate and pharynx. There are so many muscles in the pharynx: superior constrictor, middle constrictor, inferior constrictor, stylopharyngeus, palatopharyngeus, and salpingopharyngeus. All of them are supplied by this, except what? Except stylopharyngeus and tensor veli palatini. Exceptions zarur yaad rakhni. Exceptions you have to remember. So that is the job of what nerve? Cranial accessory nerve. And whatever cranial accessory nerve is doing, it is doing with the help of vagus. तो देखने में ऐसा लगता है, visually it looks like that vagus nerve is doing it, but it is not. Cranial accessory nerve is the one which supplies the muscles of palate and pharynx. Vagus nerve supplies the muscles of the larynx only, not the palate and pharynx. That is about what now? Cranial accessory nerve is. Now what about the spinal accessory? Now we said spinal accessory nerve will originate from the upper 5 cervical spinal segment like C1, C2, C3, C4 and C5. So what you see, that spinal accessory nerve will emerge from C1, C2, C3, C4, C5. All these nerves will join with each other. They go back into the cranial cavity, and they again leaves the cranial cavity through what foramen? Through the jugular foramen. Look at, I'm putting these arrows to tell you that spinal accessory nerve, that's how it is running. It is starting from the C1 to C5 cervical spinal segment, and then nerve, first it goes into the cranial cavity through what foramen? Foramen magnum. And then it comes out of the jugular foramen. ये लोग usually भूल जाते हैं. Spinal accessory nerve is a content of 2 foramen. It is a content of foramen magnum also. It is a content of the jugular foramen also. So this here is the spinal accessory nerve. And if you're wondering why this spinal accessory nerve is doing all this drama, first it goes inside and then comes out of jugular foramen. Actually, this part of the spinal cord, first the development of the spinal cord, it elongates from the neural tube. So this portion of the neural tube was actually present inside first. Later on with the elongation, it came out. So developmentally, spinal accessory nerve is not going into the cranial cavity. The origin of the spinal accessory nerve actually came out. You getting my point? The portion of that part of the neural tube which is forming this region of the spinal cord, it actually came out of the cranial cavity when the elongation of the spinal cord is taking place developmentally. What spinal accessory nerve is doing? It is supplying the 2 most important muscles of the neck, the 2 most superficial muscles of the neck, the 2 muscles which are covered in the investing layer of deep cervical fascia. And what are those 2 muscles? That is a sternocleidomastoid and trapezius. That is the function of the spinal accessory nerve. So make sure that you keep these things separate here. This here is the cranial accessory nerve, which is supplying the muscles of palate and muscles of pharynx, with some exceptions, through pharyngeal plexus using the vagus nerve. Whereas spinal accessory nerve, which is coming from C3, C1, C2, C3, C4, C5, is going to supply the sternocleidomastoid and trapezius. So this is how the spinal accessory nerve will be coming out of the cranial cavity and supplying the sternocleidomastoid and trapezius. So that is simple about the accessory nerve. 11th nerve, the cranial accessory and spinal accessory. Sternocleidomastoid, trapezius supplied by them. Now, clinical anatomy of the spinal accessory nerve and cranial accessory nerve, that when that part will come, we will discuss it there only, like in the posterior triangle only. Obviously, if the spinal accessory nerve is injured, then your sternocleidomastoid muscle will be involved. But sternocleidomastoid muscle, what is the function of sternocleidomastoid? To help you turn head to the other side. If my right sternocleidomastoid is injured, then I will not be able to turn my head on this side. So my head will be turned to this side only, because my other sternocleidomastoid will take over. So all these things, we don't have to discuss the clinical anatomy of all this nerve now, because that's a clinical anatomy of the nerve. We will discuss these in the triangles of the neck. When they are injured in the triangle, what will happen and what not. And the last cranial nerve, the 12th one, the hypoglossal nerve. Hypoglossal, the 12th nerve. Hypoglossal nerve and ansa cervicalis will be discussed together, guys. Remember ansa cervicalis? When we talked about the investing layer and deep cervical fascia, so we saw that carotid sheath on the anterior wall of carotid sheath, ansa cervicalis was present. Well, first, if we talk purely about the hypoglossal nerve, guys, hypoglossal nerve will come out of the medulla oblongata. Now, let me just draw it in a very simple manner here. If this box here represents the medulla oblongata, that is medulla oblongata, and obviously this nerve here, that is the hypoglossal nerve, which is, we have a hypoglossal nucleus present in the medulla. We know that hypoglossal nucleus is in the medulla oblongata only, right? The first column, guys, GSE, general somatic efferent column. Hypoglossal nucleus is there. 12th nerve nucleus is there. The hypoglossal nerve will come out of the medulla oblongata. It will come out of the medulla oblongata and leave the cranial cavity by a canal or through a canal. And this canal is present very close to foramen magnum. In fact, in the anterior part of foramen magnum only, and this is called as the hypoglossal canal. So there is a hypoglossal canal is there, and that hypoglossal canal is giving passage to the hypoglossal nerve. That is giving passage to the hypoglossal nerve. Now, let me see if I have that, still have that picture. Yeah, look at this, guys. See, that is the foramen magnum. This is the foramen magnum here. And if you look at the anterior part of foramen magnum, that is a hypoglossal canal. So from the medulla oblongata, the nerve will begin, and that nerve will enter into this hypoglossal canal, and that's how it will come outside. So it will leave the cranial cavity through this hypoglossal canal, which is present in the close to the anterior margin of the foramen magnum. Once the hypoglossal canal comes, it will go through certain triangles of the neck. What triangles? We will discuss that tomorrow. But the hypoglossal nerve will come and supply the muscles of the tongue. Well, as the name suggests, this nerve is going to supply all muscles of the tongue. It is going to supply all muscles of tongue. Again, you don't have to remember those names of the muscles of tongue as of now. The genioglossus, hyoglossus and all. All the muscles of tongue except one. Exceptions are always there. Except one muscle, and that muscle is called as the palatoglossus. This is very important, guys. There is just one muscle of the tongue which is not supplied by the hypoglossal nerve, and that muscle is the palatoglossus. Except palatoglossus. All muscles of tongue except palatoglossus. Why not palatoglossus? Because the name says palatoglossus. It is a muscle of palate also. The muscle actually comes from the palate and then to the tongue. So it is a common muscle. Ye muscle palate ka bhi hai, ye muscle tongue ka bhi hai. It's a muscle of palate and tongue both. And it is supplied by the nerve which is a main nerve for the palate. There we have it. We already said that muscles of the palate is supplied by cranial accessory nerve using the vagus nerve, cranial accessory via vagus, right? So that is already supplied. Palatoglossus is supplied here only. So hypoglossal nerve will not supply it. So this is a tongue. This is a muscle of the tongue as well as palate, but not supplied by the hypoglossal nerve. If I think of hypoglossal, purely about hypoglossal nerve, that's it. That is it. Hypoglossal nerve का ये function है. Hypoglossal nerve will come out of the hypoglossal canal, will go in front and supplies the muscles of the tongue, except the palatoglossus. Right? This is the only thing we have in hypoglossal nerve. But again, in head and neck, you've already seen this thing that a nerve joins with another nerve and then will serve some purpose here. Will supply some structures. Same is going to happen here. The first cervical nerve, guys, if this is medulla oblongata, if I extend this diagram downward, this will become spinal cord. By medulla oblongata will continue below as a spinal cord only. Right? This is the spinal cord. So in the spinal cord, let's say this is C1 is there. We have a C2 here. We have a C3 here, like that. We already discussed C1, C2, C3. What C1 will do, the C1 nerve will come out and it will join with the hypoglossal nerve. Now look at this. C1 nerve will join with the hypoglossal nerve. It will run with the hypoglossal nerve. And in the anterior part, it will separate to supply two muscles. And when you look at the diagram, when you look at the dissection or any atlas picture, it will look like that hypoglossal nerve is going to supply those two muscles. No. It's actually C1 fibers which are joined with the hypoglossal. They come in front and separate and supplies these two muscles. Which two muscle? One of them is called as the geniohyoid and one muscle is called as a thyrohyoid. Actually, one muscle is above the hyoid bone, one muscle is below the hyoid bone. Geniohyoid and thyrohyoid. That's one thing to remember, that geniohyoid and thyrohyoid, although they will look like they're supplied by the hypoglossal nerve, but if somebody asks you what is the nerve supply of genio, guys, if don't worry about that where exactly geniohyoid is, where is thyrohyoid is, we will discuss that all. I have to tell you the name of these muscles because we are discussing cranial nerve. So geniohyoid and thyrohyoid, both these muscles, don't say they're supplied by hypoglossal nerve, they're supplied by C1 via hypoglossal. They're using the C1 nerve is using the hypoglossal nerve to reach its destination. Well, this is still not it. C1 nerve will also use the hypoglossal nerve to go back into the cranial cavity. C1 nerve will also use the hypoglossal nerve to go back into cranial cavity. Again, same story. If any nerve is going back into the cranial cavity, it is going to supply what? It is going to supply the dura of the posterior cranial fossa. C1 branch, you can see the C1 branch is going forward also like this. C1 branch is going upward also. C1 branch is going forward, that is supplying the geniohyoid and thyrohyoid, and a branch of C1 along with the hypoglossal nerve goes back into the cranial cavity to supply the dura mater of posterior cranial fossa. After that, the C1 nerve also, there are more also here. C1 nerve also gives off a descending branch in the neck. Because this is you're already a little aware of. There's a descending branch coming from the C1. It is running in the neck, in front of the carotid sheath. This branch is coming from this branch looks like it is coming from hypoglossal nerve, or it is coming from the region of the hypoglossal nerve. So we call it descendens. The nerve is called as descendens hypoglossi. This nerve is called as a descendens hypoglossi. Similarly, C2 and C3 branch, obviously they are not connected to hypoglossal nerve. C2 and C3 have no connection to hypoglossal nerve, but they will also give a descending branch in the neck parallel to this nerve. This is called as descendens. It is descending, so again descendens. But this is descending directly from the cervical nerve. So we call it descendens cervicalis. So that was descendens hypoglossi, which is coming from where? C1. And that descendens cervicalis is coming from C2. Both these nerves, they will join with each other. And that is called as the loop of ansa cervicalis. That here is the loop of ansa cervicalis. Guys, remember ansa cervicalis? It was the anterior relation of carotid sheath. You have to connect all these points, whatever we discussed earlier. That's why I keep saying that you have to read the previous part. It is all in a very much sequence here. हम आगे पढ़ेंगे, पीछे वाले को connect करते रहेंगे. So that ansa cervicalis, if you remember, it was the anterior relation of the carotid sheath. It is exactly adherent to the anterior wall of carotid sheath. And there are two roots of the ansa cervicalis. One is descendens hypoglossi, one is descendens cervicalis. In short, we say that ansa cervicalis supplies the strap muscles. Strap muscles are the muscles of the midline of the neck, which are present below the hyoid bone. All the muscles of the neck which are present below the below the hyoid bone in the midline are strap muscle. Sternothyroid, sternohyoid, omohyoid, all these are strap muscles, and they are all supplied by the ansa cervicalis except one. So in this ansa cervicalis, what you'll see, descendens hypoglossi will supply a muscle which is called as the superior belly of omohyoid. I will show you that muscle in a while. That is called a superior belly of omohyoid. And whereas the lower part, the loop part here, is going to supply the remaining three strap muscle, which is the inferior belly of omohyoid. Then there is a muscle called as the sternothyroid, and there is a muscle called as the sternohyoid. ये सब कौन सी मसल है? We call them strap muscle, S-T-R-A-P, strap, like scale-like muscle present in the midline of neck. But remember, below the hyoid bone. They are all below the hyoid bone. Superior belly of omohyoid, inferior belly of omohyoid, sternothyroid, and sternohyoid. Superior belly of omohyoid, you can say, is supplied by descendens hypoglossi, and rest are supplied by the loop of ansa cervicalis. थोड़ा और अगर precisely बताए तो it is like superior belly of omohyoid is by descendens hypoglossi, and the loop of ansa cervicalis supplies the remaining strap muscles. So we say all the strap muscles, guys, all strap muscles are supplied by ansa cervicalis except one. Except one. Which one? There we have it. This is the only strap muscle. This is the only strap muscle not supplied by the ansa cervicalis. It is the only strap muscle which is not supplied by the ansa cervicalis. Genohyoid nahi. Genohyoid is above the hyoid bone. Look at this. If this is a hyoid bone for me, there is a muscle which is below the hyoid called as a thyrohyoid. Obviously, it is between the thyroid and hyoid. And there is another muscle called as geniohyoid. Geniohyoid is from the mandible. It is a muscle from the mandible to the hyoid that is called as a geniohyoid. So geniohyoid is above the hyoid bone. It is not a strap muscle. Geniohyoid is not a strap muscle, but thyrohyoid is a strap muscle. And that is the only strap muscle which is not supplied by the ansa cervicalis. I want you to please write down this about strap muscles. Strap muscles are the midline muscles of the neck which are present below the hyoid bone. Midline muscles of the neck which are present below the hyoid bone. Below the hyoid bone. Strap muscles are the muscles of neck which are present below the hyoid bone. So that concludes the cranial nerves for us, guys. This is about the cranial nerves. Before I show you some picture and try to explain you this in a different way, let's do one thing. Let's try to summarize the exceptions, whatever exceptions we discussed here. If I just write down some exceptions that we have discussed in last 2 days, because these are very important Viva questions or straight one-liner questions. Now, what exceptions we talked about? If I start with the, let me start with the mandibular nerve, that the first motor nerve we talked about. We said all muscles of mastication, all muscles of mastication are supplied by the anterior division of mandibular nerve. All muscles of mastication are supplied by the anterior division. We saw it. All the muscle of mastication are by the anterior division, except one. Except which one? Except medial pterygoid. Because we saw medial pterygoid was supplied by what? Medial pterygoid was supplied by the trunk of mandibular nerve. It is not by the anterior division, it is by the trunk of mandibular nerve. That is the first exception we saw. Let's keep highlighting these exceptions here. So we said all muscles of mastication, medial, lateral pterygoid, temporalis, masseter, they're all supplied by anterior division, except medial pterygoid, which we saw medial pterygoid was supplied by the trunk. all muscles of palate. Today only we discussed all muscles of palate are supplied by cranial accessory nerve via vagus. Using the vagus nerve only, right? All muscles of palate are supplied by cranial accessory nerve via vagus. All muscles of palate are supplied by cranial accessory via vagus. You know this cranial accessory via vagus is called vago accessory complex ही बोलते हैं. Cranial accessory nerve was using the vagus nerve to supply the muscles. So this is also called as a vago accessory complex. It's a complex of vagus and accessory nerve. Either you say cranial accessory via vagus or you can call it VAC, guys. You can write it somewhere separately. That is, VAC means vago accessory complex. Cranial accessory and vagus are joining. So that complex is also called as a VAC, vago accessory complex. So yes, all muscles of palate are supplied by the cranial accessory via vagus or vago accessory complex, except which one? Except tensor veli palatini. Except tensor veli palatini, which is supplied by what? Which is again supplied by the mandibular nerve, by the same the trunk of the mandibular nerve only. Both the tensor muscles are supplied by mandibular nerve, na? Okay. Then we said all muscles of pharynx, all muscles of pharynx are supplied by, all muscles of pharynx are supplied by, again, cranial accessory via vagus, same, VAC. They're supplied by cranial accessory via vagus. All muscles of pharynx are supplied by cranial accessory via vagus, except stylopharyngeus. Except stylopharyngeus. Although there is one more muscle which can come into this category, that's a part of inferior constrictor called as the cricopharyngeus part. Cricothyroid nahi, cricopharyngeus also. You can write except stylopharyngeus and cricopharyngeus. But I would want to tell you about the cricopharyngeus in the pharynx only. Uske पीछे actually कुछ थोड़ा सा और there is something more about it. Cricopharyngeus ki actually it usually have a innervation from the other nerve as well. So let's not write cricopharyngeus. Let's only stick to stylopharyngeus only. And we said stylopharyngeus was the only muscle supplied by what nerve? By the glossopharyngeal nerve. Stylopharyngeus was the only muscle supplied by the glossopharyngeal nerve. That was another exception we discussed. Then we said all muscles of larynx. Today only we discussed all muscles of larynx are by recurrent laryngeal nerve, right? Recurrent laryngeal nerve was coming back and supplying all the muscles of larynx, except which muscle? Except one muscle of larynx which was present outside, and that was cricothyroid. Except cricothyroid, if you remember, cricothyroid was supplied by the external laryngeal nerve. Was supplied by the external laryngeal nerve. So all muscles of the larynx except cricothyroid are supplied by the recurrent laryngeal nerve. Cricothyroid is supplied by external laryngeal nerve. Something we just discussed, all muscles of tongue. We said all muscles of tongue are by which nerve? Are by the hypoglossal nerve, right? All the muscles of tongue are by hypoglossal nerve, except which one? Except palatoglossus. Except palatoglossus, and palatoglossus is supplied by the, again, same cranial accessory via vagus. Let me write VAC this time. Vago accessory complex, or you can say cranial accessory via vagus. All muscles of tongue are by hypoglossal nerve except palatoglossus, which is by vago accessory complex. And then finally, all strap muscles. All strap muscles are supplied by ansa cervicalis. All strap muscles are by the ansa cervicalis. Except which one? Thyrohyoid. Thyrohyoid is the only strap muscle which is not supplied by the ansa cervicalis. In fact, it is supplied by what nerve? It is supplied by, what is it supplied by? It is supplied by the C1 via hypoglossal. It is supplied by the C1 nerve using the hypoglossal nerve. C1 via hypoglossal. Exceptions के ऊपर अलग से questions आ जाते हैं. That's why you should know all the exceptions. These are all exceptions we have here. Muscles of mastication में एक exception है, palate में एक exception है, pharynx में एक exception है, larynx में एक exception है, tongue में, और again in the trap muscle. So all these group of muscle, they're having one exception, and you should know that what nerve is going to supply them. Look at this huge picture here. This is so many nerves in there. This here is a pterygopalatine ganglion, PPG. I hope you can see that clearly. Pterygopalatine ganglion. And obviously, the nerve here is the maxillary nerve. This nerve here is the maxillary nerve. Abhi maxillary nerve is continuing down below the orbit, we said, or in the floor of the orbit as what nerve? That is an infraorbital nerve. It is continuing as an infraorbital nerve. And you can see maxillary nerve is giving off the branches which are piercing the body of maxilla from behind. That is posterior superior alveolar nerve. एक भी हो सकता है, दो भी हो सकता है. They have shown two nerves here. That's not a big deal. So basically, these here are the posterior superior alveolar nerve. That is posterior superior alveolar nerve. This one here is a middle superior alveolar nerve. And this one here is the anterior superior alveolar nerve. And you can see ultimately the nerve is coming out as infraorbital nerve and supplying from the infraorbital foramen and going to supply the skin on the face below the orbit, right? This is, we discussed it yesterday also. What else we can see in this image? What else we can see in this image is I can see the mandibular nerve very clearly here. I can first see all the muscular branches of the mandibular nerve. Look at all these are the muscular branches of the mandibular nerve supplying the muscles, temporalis and all that. What important is to be noticed here is that the one, apart from the muscular branches, apart from all these muscular branches, the one branch which I can see is going forward and will be supplying the skin of the cheek. That is a buccal nerve that you see here. That's the buccal nerve that you can see, which is running forward, and that will be supplying the skin of the cheek and the mucosa of the cheek also. Just major nerve identify karte hain guys, not anything. Now, obviously, this nerve is very easily identifiable based on this artery here. You know that this artery here is what? Middle meningeal artery. That is a middle meningeal artery. Now, that is a middle meningeal artery. The nerve which is running along with it is the nervus spinosus. That is a nervus spinosus. And this here is the auriculotemporal nerve. Look at this. The nerve which is looping around and going backward, that is a auriculotemporal nerve. What are the other two major nerves that you see descending down? One is auriculotemporal nerve. The two other nerves which are the main nerve from the posterior division is the lingual nerve. Now, this here, if I just put it this way, this here is a lingual nerve. Look at this, guys. This is a lingual nerve. Why? As you can see, the submandibular ganglion is also related to it. That's a submandibular ganglion below. So this is the lingual nerve here. That is a lingual nerve. And I hope you can see that chorda tympani is joining it. Look carefully. Can you see that chorda tympani nerve is joining it from there? That's how the chorda tympani nerve will be coming and joining it here as well. If this is a lingual nerve, of course, this ganglion here is a submandibular ganglion. If I label it as SMG, that is a submandibular ganglion you can see below. And what nerve is this? This nerve, you can see it is entering inside the mandible. If I just zoom out a little, you can see that is the inferior alveolar nerve. This nerve here is the inferior alveolar nerve. One of the posterior division, inferior alveolar nerve, which will go inside and supply the alveoli and come out as what nerve from here? As the mental nerve from this part. The branch of the inferior alveolar nerve which runs downward and supplies the anterior belly of digastric and mylohyoid. Look at that nerve. That is what? That is the nerve to mylohyoid. This here is the nerve. I'm writing nerve to MH, to the mylohyoid. Nerve to mylohyoid. See, this is a cut end of trunk of facial nerve. They have not shown facial nerve here. That is a facial nerve, guys. This is a facial nerve coming out of the stylomastoid foramen, and they've cut it. You can see the true trunk of the facial nerve, which we said in the parotid gland. We have the two trunk here. One was what? One was a cervicotemporal or temporocervical, you can say, and one was a cervicofacial trunk. So the two part, which again will divide into further branches and in the parotid gland. So parotid gland and everything is removed from here, so we can't see it. What other nerve we can identify from this picture is, first, let me highlight this and then I'll rub it off. Look at the hypoglossal nerve first. There we go. Let me just mark it with a dark one. This is the hypoglossal nerve. and then it will go and supply the tongue muscle. That is a hypoglossal nerve. Now, why I am saying it is hypoglossal nerve? First of all, hypoglossal nerve, कौन सा nerve join कर रहा था? C1 nerve was joining it. C1 nerve joins the hypoglossal nerve and then will leave the hypoglossal nerve to supply one muscle which will be in this region. What muscle? Thyroid. They have not shown thyroid muscle, but if thyroid muscle has been here, is present, it will be here only, between the thyroid and hyoid here. So that's C1 nerve coming from the hypoglossal. हम उल्टा देख रहे हैं, हमने ऐसे draw किया था, we're seeing it in the other way. What else? This is interesting, guys. Look at this. From the hypoglossal nerve, can you see descendants hypoglossi? Look at this descendants hypoglossi coming down. And look at this, which is coming from C2 and C3. And that is also descending down and together forming the ansa cervicalis. I hope you can are able to see the ansa cervicalis. So we have a descendants hypoglossi coming from the hypoglossal nerve. And from the C2 and C3, we have a descending branch, that is descendants cervicalis, together forming the ansa cervicalis. You can see one branch they have shown here, which is going to supply the superior belly of omohyoid, and the rest of the strap muscle will be supplied by the lower part, from the loop of the ansa cervicalis. And it is present in front of carotid sheath. You can see it is present in front of the carotid artery. So it is in anterior relation of the carotid sheath only. Don't bother about these nerves. These are the cervical nerves actually. C2, C3, C4, the major nerves which are going out cervical plexus. So again, don't get too much bothered with that. I just want you to understand the relevant nerves that we've discussed and that you should remember. Glossopharyngeal nerve can be seen here as well. Let me use a different color to denote that, guys. I'm using a blue color here. Look at this. Glossopharyngeal nerve. Here we go. It comes out like this. And we said glossopharyngeal nerve, it will be going deep to which muscle? We said it is going deep to the hyoglossus muscle. It's going deep to hypoglossus muscle. And which muscle it supplies? The only muscle supplied by this is the stylopharyngeus muscle. This is the only muscle supplied by the glossopharyngeal. That's a part of glossopharyngeal nerve I can see here. What else I can see from glossopharyngeal nerve? It is supplying the stylopharyngeus muscle. It is obviously contributing to the plexus, that is, we are not bothered about that. It is going deep to hyoglossus. And one important thing that you can notice from this diagram only, look at this branch, which I'm pointing at right now, going down and giving off the supply to the carotid body and carotid sinus. Nerve of Herring. Glossopharyngeal nerve, it is giving off the nerve of Herring also, which obviously will supply the carotid body and carotid sinus. It is not easy to identify all these nerves. You can see there are so many branches coming in because they're contributing to the pharyngeal plexus. So don't worry about everything here. You don't have to identify everything, but yeah, still a lot of things can be identified here based on the relations that we've discussed. Now, based on the relation, I can see the vagus nerve running there. That's a vagus nerve which is running at the back here. That's a vagus nerve running back. But I am not able to identify the branches of vagus nerve because of the carotid artery and everything is placed here. But I can see the branch of vagus nerve here. Look at this, guys. This is a branch of vagus nerve we said will pierce the thyroid membrane. That branch of vagus nerve which pierces the thyroid membrane, that was the external laryngeal nerve. And the branch of the vagus nerve which will go down and supply the cricothyroid muscle. Sorry, this is external laryngeal. I'm sorry. That is external laryngeal nerve. The one which was going inside is internal laryngeal nerve. It is going inside to supply the mucosa of the larynx. And the one branch which is coming down here and supplying this external cricothyroid, that is the external laryngeal nerve. That is external laryngeal. अभी इतना भी identify कर लिया ना, that's more than enough. Actually, more than enough. All other small things, like if you see other things here, because sympathetic chain is also there. If you see these ganglions here, that is because of the sympathetic chain is there. Okay. Then this main nerve, there is a vagus nerve. Then the nerve which is coming back here, that what nerve is that? That is a recurrent laryngeal nerve. You can see it is coming in the trachea, between the trachea and esophagus. That's a recurrent laryngeal nerve. Let's go slow and easy. These are the brachial plexus. Look at the brachial plexus will be coming out between the scalenus anterior and scalenus medius. So it will take time. It will take time to understand and identify all the nerves. But what I believe is that if you really go in a good sequence, if you try to understand the nerve that we've discussed, so it doesn't matter how complicated diagram or how complicated images is given. People usually have nightmare about these images, guys. I mean, look at this labeling here. Look at this labeling. Abhi isko labeling padhte na, it will take an entire day only. You have to pick up a nerve and then you have to go and see what nerve is that, where it is coming from. But once we are done with all the nerves, once we are done with all the muscles, once we are done with the blood vessels, once we are done with the triangles, fossas in the head and neck, doesn't matter whatever atlas image, whatever cadaveric picture they will give you, you still will be able to identify each and everything in it here, each and everything.